easy menstrual pain relief regimen that works. One of the most dreaded days of every woman is the day when their monthly period starts. Lucky are those who do not have to endure the pain of their monthly menstrual cramps, and so sorry for gals who have no choice but to sit through it till their period ends. Menstrual cramps, also known as dysmenorrhea, are characterized as throbbing pains that usually occur in the lower abdomen. This annoying pain is basically an indicator of the start of a woman's cycle. However, the pain mostly triggers during the menstrual period. For some women, the pain can be tolerated, but it can become intense to the point that it can affect a woman's daily activities. Women who are more susceptible to menstrual cramps are those whose period lasts for more than 5 days, those who are obese and overweight, those who are big alcohol drinkers and cigarette smokers, as well as those who start their period at an early age. Since menstrual cramps can become so intense to most women, they oftentimes rely on drugs or medications to relieve the pain. However, it is not really good for women to become overly dependent on medications. There are, in fact, a number of natural pain relief regimen that a woman can do to get rid of annoying menstrual cramps. The following are some helpful natural pain relief treatments that every woman should know in order to lessen and avoid menstrual cramps. 1. Soak in a warm bath. Taking a warm bath once the pain starts is perhaps one of the most recommended quick remedies of many doctors. Women who are always suffering from menstrual cramps can also try using a heating pad to ease the pain. 2. Massage your lower abdomen. As the pain starts to trigger, massaging the lower abdomen is a good way to reduce the cramps. The perfect way to do this is by lying down and repeatedly massaging the pained part of the body. 3. Regular exercise. One of the best ways to avoid menstrual cramps is to make some changes in lifestyle. Regular exercising, for instance, will surely make one less susceptible to menstrual cramps. 4. Eat more carbs. If a woman suffering from terrible cramps every month will add more carbohydrate-enriched goodies in her daily diet, menstrual pain is sure to lessen. Such as recommended by most doctors as drinking too much alcohol and caffeine, smoking, as well as eating salty foods are discouraged. 5. Get enough rest. Stressed women are the ones who are more prone to experience menstrual pains. As such, doctors always advise women to have enough sleep and rest in order to avoid pain once menstruation starts. Some doctors also recommend patients to try yoga exercises and massages, as these are great complementary and safe remedies for menstrual cramps. Although the treatments mentioned above are not 100% effective and there are no studies that can further prove their efficiency, they are nonetheless superb complementary pain relief treatments for women who are frequently suffering from agonizing menstrual cramps. Women are 3 times more likely to have migraines than men. This differential does not begin until the females reach puberty. 60% of women have migraines related to the menstrual cycle. About 14% have migraines purely coordinated with menses. Could menstrually related migraines be solely linked to estrogen? That would be like saying migraines are only headaches. We now know migraines are much, much more than headaches. Menstrually related migraines are much more than estrogen fluctuating in the body. Serotonin, prostaglandin, norepinephrine, melatonin, and other chemical levels fluctuate with the menstrual cycle. Each plays some role in menstrual-related migraines. Menstrual migraines usually start between 2 days before the onset of menses and 2 days after the onset of menses. A simple option is to take naproxen 500 mg twice a day with food during these 5 days. It is important to take anti-inflammatory medicine with food to help prevent stomach ulcer formation. Do not take if you have a history of ulcers, bleeding problems, or allergy to aspirin. Naproxen will not only help prevent migraines, but it will also help reduce cramping. Certain over-the-counter supplements can be helpful. Never take triphasic birth control pills. Even women who do not have menstrual migraines seem to do better on monophasic birth control pills. Oral contraceptives can come in packs with different color pills, 21 pills of one color and 7 of another color. This would be a monophasic pack, either you are on estrogen or you are not. A bi- or triphasic pack would have several different color pills. Every time the color changes, the estrogen dose changes. This is a roller coaster you do not want to be on. The concept of women perpetuating monthly menses must have come from a committee of men. Who wants to have monthly menses? So she can know she is not pregnant? Well, I have a son that disproved that notion. No, women would consider the 28-day cycle to be normal as the reason given, and anything different would be perceived as abnormal. I frequently recommend my migraineurs to leave off the placebo pills and just take the oral contraceptives for 3 months or more. The longer they have been on the pills, the easier the transition occurs. Actually, if a woman wanted to have 1 menses a year, I would have no objection. Now that oral contraceptives have a very low dose of hormones, it is very important to take the pill approximately the same hour each and every day 7 days a week. This lessens the chance of spotting or bleeding. Some women do better with their headaches if they take the pill at night, however, it needs to be the same hour each and every night 7 days a week. Bedtime for most people is not the same every night, but they would do better in general. Migraineurs often tolerate birth control pills very well when they are taking a monophasic pill, however, some women cannot tolerate the pill. Smoking is a no-no, especially with migraines. Smoking and taking oral contraceptives is suicidal. The risks of strokes and blood clots are increased. Do not smoke. For women do not have to be concerned about pregnancy. One possible way to decrease menstrual migraines is to wear an estrogen patch, apply estrogen topically, or take estrogen orally at the time of menses. Triptans are medicine used to stop migraines. As a general rule, triptans are not used to prevent migraines. Nevertheless, in menstrual migraines, using triptans may be helpful and are given once or even 2 or 3 times a day during the 5-day window of greatest problems. Thanks for watching. Smash that subscribe button. And click the notification bell.